Welcome everybody to the Healthy Hip Dysplasia podcast. Today with us we have Joy who lives in Northamptonshire. Thank you for joining us, Joy.
Hi Laura, it's great to talk to you.
I'm so excited to hear a little bit more about your story. We've been connecting on socials behind the scenes, and the story that you have to share is one that I think is really, really important. I know it's gonna hit some emotions along this journey, but I think it's so important to share your story and to raise awareness of some of the things that you've been through. So would you be kind enough to tell us a little bit more about your journey, where it started, and kind of where we are now?
Yeah, of course. I was quite late to get a hip dysplasia diagnosis, which I know is very typical of of a lot of people on this journey. I never knew I had the hip dysplasia as a child, but I was one of those children that sat watching TV with my legs out in two V's. There was obviously a lot of mobility in those joints, and that went on until I was about 15. I used to always sit on the floor with my legs out. Um, Interestingly enough, I did have my coccyx removed when I was 16. I had a twisted coccyx. Nobody knew how. It was very painful to sit on. And now at this age, looking back, I do always wonder, is it something to do with the anatomy of a dysplastic hip? I don't know. But there was quite a lot of physio involved with recovering from a coccyx removal. And they always used to sort of stop and be shocked at the mobility in my hip. You know, they'd put you in a tabletop position, move my leg to side, and it could nearly reach my head. They'd call people in and say, look at this, but nobody thought about hip dysplasia. So that does disappoint me a little bit. And my hips always hurt. And I used to think because I'd got a damaged coccyx, it's because I sat on one side. I thought that was what the pain was. But looking back, I now know it was an early indication of hip dysplasia. But I just got on with it, as you do, as we all do. I got married, I've had a child. And when life got a little bit easier, when my son grew up a little bit, I started really falling in love with trekking. It's like my passion. I absolutely love the outdoors. Just walking, just a simple thing, walking. I love mountains. And I sort of really threw myself into it, sort of 2016, 17. I was about 44 then, and I did a lot of UK treks like Snowdon, the Malvern Hills, the Jurassic Coast, the Gower Peninsula, Helvellyn. I did a scramble on Cribgoch at Snowdon. I just threw myself into it. I did all this trekking and I absolutely love it. My husband loves it as well. But I started to really suffer. And it's one of those things, isn't it, where you think, oh, my hips are really hurting. Oh, I'll be okay, I'll be okay. I've probably overdone it. You just keep pushing it back, pushing it back. And I do remember going to the GP and asking for an X-ray. And I stupidly said, does that X-ray look like an old lady hip to you? And I just was looking for some reassurance. She was like, no, no, no. That was it. So I was like, okay, back out on those mountains. Yeah, and then I did a trip to the Mont Blanc region. I stayed in Chamonix and just walked all the mountains there, and that was the crescendo. Or I was actually limping a lot, and I thought, oh, that this is quite bad, because ultimately it was only walking. It is uphill, mountainous region, but it wasn't like I was doing anything, excessive. And so I went back to the GP and I said, I'm not coming to see you because my hip's sore. I am coming to see you because I'm at the end of my tether with it. I need some help. She was brilliant. She said, you need referring. I said, yeah, could you refer me? So I went to see an orthopedic surgeon in August 2018. I'm not going to say who I saw, but it was somebody local from a local hospital, and he was very dismissive, did an X-ray, shrugged, said arthritis. And I was a bit shocked. I was like, really? Because I'm quite young. I'm 46. I think I was 45 then, and up 44. I was like, wow, I've got arthritis. He's like, yeah, yeah, arthritis. Just we can do an injection. That's what he said. We can do an injection. I was like, okay, what's that for? And he said, well, it's diagnostic, because if your pain goes away, then it's coming from the socket. So I had an X-ray guided injection in October 2018. So yeah, I was 44 then. and it took the pain away. It took the pain away completely. It was like a miracle, not for very long, probably 10 weeks, 9, 10 weeks, but it felt amazing. So I knew that the problem was the hip joint. Um, and during that time, I just saw physios. And obviously, if you tell a physio you've got arthritis, according to your surgeon, you've got arthritis, the guidance they give you is totally different to if you've got hip dysplasia and a labral tear. And I specifically asked him, because I've done my own research, I was like, are you sure I haven't got a labral tear? Because it feels like a labral tear. It's very specific. No, 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 you haven't got that. So I was like, oh, okay. So yeah, I went to these physios, and when I look back now, the things they did, one of them put a seatbelt, like a seatbelt material, around my inner thigh, around himself, his own body, so that he could lever my hip out of the, to sort of loosen it, which is like the worst possible thing you could do for a labral tear. And from that physio appointment, it literally cracked every single step all around the kitchen. It was so much worse. So yeah, they were dark days really, because I used to look around at old people and think, God, you're suffering so much. If this is what arthritis feels like, it's pretty bad getting old. I was really full of sort of shock, I think. And then there was just one day, how it's funny how it's always August, because it was August 2018 when I first saw him, August 2019, so 1 year later. I used to regularly go back and see this arthritis surgeon. I don't know what for, he just used to check how I was, but he wasn't there this day, and I had a stand-in registrar. I wish I knew the name of that man. Wish I could thank him really, because he looked at me, he looked at my x-ray, and he went, you haven't got any significant arthritis. Can you imagine how that made me feel? And at the same time, I said, do you think I've got a labral tear? While he was saying, I think you've got a labral tear. So I was like, oh my God. So he's like, you need a special scan for that. You need a scan, MRI with contrast. It will show the tear in the labral tissue. I'm not sure where they do it. And I said, look, I'm pretty desperate. To say I'm life limited would be an understatement. There are so many things I can't do. Please, can you find out where I can have that scan? I'll go anywhere. I said, I'll drive to Scotland if I need to have that scan. He went away, come back. He was like, oh, they do it in this hospital. So I was like, wow, they do it in this hospital, but I hadn't been offered that. So I had the MRI with contrast. And then in November, so 3 months later, I was called back in, and I did see my original consultant. And again, who's quite dismissive, just walked in and said, right, you're being referred, just like a brush off like that. And not really this sort of person, but I felt really, really angry. And I know misdiagnosis is a common thing with hip dysplasia, but I do wish awareness would be so much better, because it was such a lot of unnecessary suffering. So he said, you're being referred, and I stopped him and said, are you referring me because I've got a labral tear? And he said, yes. And I said, but I asked you, could I have a labral tear? And you said no. And he said, I don't treat labral tears. And I said, I'm sorry, that's just not good enough. If you don't treat if you don't treat cancer, you're not an oncologist. Would you not tell me I had it? I just felt so angry. But he was apologetic, to give him his due. He did apologize. And I said, could you just promise me, when you look out in your waiting room and you see a youngish person sitting with all the elderly ones, that you might think outside the box and think, maybe it could be something else. Could you please not leave someone else like you've left me? So he referred me. So in December, so he did it very quickly. So I went a month later to Leicester to see a doctor called Dr. Kulkarni, who was lovely. Looked at my scans, sat on the corner of the desk and just sort of grabbed my hands really. And he said, you have got a large labral tear, but you've got something else, you've got hip dysplasia. And he said, and I'd never heard the words before. So he said, I could sew your torn labrum, which I thought, because I'd read about a labral tear, I thought, oh, they arthroscopically sew it back up. That's fine, I can cope with that. And he said, I can't sew it back up. It will tear again. You've got such shallow sockets, it would just tear. You need a much bigger surgery. You need a periacetabular osteotomy. I was like, I'd never heard of it before, PAO. So he said, I'm going to refer you up to Newcastle, which is 4 hours away from where I live, to have a PAO. Yeah, so it was a lot. It was a lot to take in. Um, it was when COVID was just starting, so we travelled up to Newcastle, my husband and I, to see the consultant that he'd referred me to. I think they went to university together, and he was like this. He is a very fantastic PAO surgeon, like I think one of the country's leading, because he does it in a very small incision. And there were signs everywhere saying, have you been to China? It struck me as a bit strange. Have you been to China? Because you wouldn't have been allowed in if you had, because COVID was just starting. So yeah, he sat me down and said, you are a good candidate for a PAO. That's what he said to me. He said, because I was 46 by this time. But he did say to me, it's a very long recovery, longer because you're older. But you don't have significant arthritis, which makes you a good candidate. So I thought, God, I'm so lucky, because I can hold on to my own bones. And I knew that he'd said it was a long recovery. I had no idea what I was letting myself in for, but I thought, okay, I can do this. So April 2021, I travelled up to Newcastle, which is like 4 hours. My husband just dropped me and went. There was no visiting for 8 days. I was there, no, just on your own. It was hard. It was really hard. At that time, I did connect with two ladies that were also having a PO. They were actually having it the week after me. So we had a fantastic support group, which, sort of 3 years later, we're still in touch. Oh, the support from that is a lifesaver. Can't recommend that to anyone enough who's going through anything like this, because it's a lonely journey. It's a long journey, and nobody can really understand. Yeah, if you haven't been through it. So I went up for a PAO. It is a hard operation. There's no two ways about it. It's very invasive, isn't it? And I know they control your pain very well with opioid medication, but that was sort of my stumbling block, because I didn't cope very well with fentanyl, Oromorph, oxycodone, all of the very strong. I was very, very unable to recover on those meds. I know how important they are because of the pain that you're in. But after 3 days, I wasn't able to keep any food down. I couldn't sit up. I'd faint, pass out. I couldn't get out of bed, 'cause obviously mobility is really important. I couldn't recover. Um, so I had a word with the staff nurse, like their senior nurse. I was really upset. And I said, I can't recover like this. I was still catheterized, still bedridden, and the bed had been propped up so that I thought something was wrong. I thought something, I felt so unwell. I couldn't function. My brain felt like it was on go slow. And I just said to her, I don't think I can recover like this. I can't do the physio. I can't even get out of bed. I woke up at one point with 5 people holding me backwards on a chair. It's not a good idea to faint when you've had your pelvis broken in 4 places. All of that wasn't great. So she said, no, you're right. I think you're reacting to the opioids, and it's the best thing is really, we're going to take you off them, which is going to mean a lot of pain. But at that point, I was just so afraid. I wanted to get out of bed, really. I wanted to start walking. And so she said, you can have your paracetamol, good old paracetamol, and your ibuprofen, a strong anti-sickness, and like even on one coat, you can do one codeine at a time. So that's what I did, which made the pain a lot. It makes me emotional because it was a lot. It was such a hard recovery for that reason, because I had a lot of pain. And we weren't given compression socks at the Wandsbek General Hospital, which is just a key point that I think I should mention, because I don't think any other hospital in England doesn't give you compression socks for such a big surgery. But we went down to theatre in compression socks and came back without them. So just want to mention that bit, and it will make sense in a while. So yeah, so I was in hospital for 8 days. We did the blood thinning injections. I think it's called tinzaparin. It's a blood thinning injection that you do yourself at home. But my mobility wasn't great. Even as far as, to get up to go to the toilet, there was a lot of pain. So it put me off drinking a lot. It put me off moving, which is not great. And even in comparison to my PAO buddies, I would see that one of them was in the beer garden quite early on in recovery, and I'd think, I'm struggling to come out of my bedroom. I really was immobile, because of the opioid intolerance. So that would not happen to everybody that had a PAO. It's specific to me. So I came home from hospital. It was a 4-hour journey, not easy in that condition, but we did it. My husband was and is amazing. And then, yeah, so 4 weeks of blood thinning injections and a very slow recovery. And then on the 5th week, I stopped the injections. Still very, very painful. It was a long recovery. And then I just woke up it was actually on the 6th of June. So I'd had my PAO April the 19th. So it was 5 weeks. I think it was the 29th or the 19th. And I felt quite a bad pain in my back. And you know what we're like, because we're British. I was like, oh, it's nothing. I'm not going to make a fuss. I'm already sick of myself. I'm sure you're all. I was like, oh, I've probably pulled a muscle, it'll be fine. And at that time, my husband was still showering me, on the shower seat. So we got up and had a shower, and it just got quite a lot worse. I got him to rub it. I thought it was a muscle in my back. And when he was rubbing it, I thought, no, I can't even feel it. Whereas I think if it was muscular, I'd have felt it on the outside as well. I nearly didn't ring 111 because I had took 2 paracetamol. The only reason we called 111 was because I started to feel short of breath, quite noticeably short of breath. So I felt like I couldn't say a full sentence. And when we rang 111, I know how bad it had got because I couldn't talk to the lady. I couldn't do that on the phone. So my husband had to do it. And again, the NHS, amazing, because when you really need help, they're fantastic. And they knew exactly what was wrong. And within 8 minutes, there was a blue light ambulance outside the door. And my son actually had run up to the street light to guide them in. And yeah, they took me to hospital. And even like going to hospital in an ambulance, nobody really understands what PAO is. They think you've broke your hip. How have you broke your hip? And you think, oh God. And they weren't going to let me take my crutches into hospital. They were like, no, you'll be fine. I was like, oh, I need my crutches. I need my crutches wherever I'm going. And again, I'm going alone because it's COVID. So it was so terrifying. And when I got there, they were fantastic. They immediately put me on a CT scanner with dye. And then, yeah, the lady came in and drew the curtain, and she said, you've got large blood clots, top, middle and bottom of both lungs, pulmonary embolisms. And I didn't know anything about what that meant. I didn't know if I was going to die. And I said to her, am I going to die? And she said, no, you've caught it early. You can't move from your bed. You can't even move. I mean, I couldn't move very well anyway. I was still on 2 crutches, but she was like, you need to go to the toilet. We'll take you in a wheelchair. You have to stay very still, because the idea is that these blood clots on your lungs don't dislodge. So you're on very sort of strong blood thinners. I mean, I stayed on blood thinners for 1 year. So I think that was a very serious situation, and it was a mixing pot of no compression socks, a very immobile patient. I didn't have a visit from a district nurse because of COVID. She possibly would have seen that my lower leg had swelled up, but with a PAO, your leg does swell anyway. So that's an easy miss. And yeah, not being able to tolerate the opioids put me immobile, and being dehydrated because I didn't want to get up very often to go to the toilet. So it was a mixing pot. I've since been given the all clear from haematologists. There's no residual lung damage. The body is amazing. I can remember sitting there saying to the consultant, tell me what to do, tell me what to do to get better. And he just looked at me and said, your body will do it. Do nothing. Take your blood thinners. You will get better. And I honestly, I know it's a bit spiritual, but I looked out the window and I just thought, God, my body is amazing. It's already recovering from a massive surgery. And now it's got another job to do and it will do it. And yeah, it was a really tough time. But I did fully recover with no residual lung damage, no damage in my veins and my leg, nothing, I'm fully perfectly fine. But it was terrifying. So in order for the PAO to be a success, obviously I needed that full year recovery. I'd say for someone older, it is a full year. At 9 months, I had my screws removed. Back up in Newcastle, the screws came out. My surgeon in Newcastle was horrified that I'd had pulmonary embolisms, and told me in no uncertain terms I would never be a candidate for a PAO on my left side because of what had happened with the blood clots. He didn't really need to tell me that because I wouldn't have gone anywhere near it again, personally, anyway. But the left hip was really starting to play up then. It had taken the lion's share of doing all of the walking on crutches, with the recovery. And yeah, it was really painful. So when he took the screws out at 9 months, he put under a general, he put a steroid injection in my left hip to help that as well. So that was kind of the stage I was at. That was a good place to be for that little window of time, was very good. My PAO seemed to have worked. My screws came out. That took a lot of pain away. So I felt really good. So good, in fact. I started walking again. I did two things. I did Hadrian's Wall up in the north, which was lovely. I did a trek. Yeah, a little bit hobbly, but yeah, full of gratitude for being out there again and being walking. And then I did an Italy trip, went to the Amalfi Coast with a walking group. And yeah, I mean, some of those Amalfi hills are steps and steps and steps. So I got those trips in, but even in Amalfi, I thought, it's not feeling great. Am I overdoing it? It's not feeling great. Yeah, and that's really that I started to go downhill quite quickly. So it'd only been just over a year from my PAO. And then just got bad, got worse. I didn't really know what to do. I felt a little bit lost. I'd been told I wasn't a candidate for a PAO on the left side, but the right hip where I'd had my PAO was also really painful. And in particular, I can remember going up for a hip injection. It was February this year, February 2024, hip injection in my left side, but I was on crutches for the pain in my right hip. And I just knew I was in a bad way and I didn't really know what to do. I really didn't know what to do. I was a bit desperate. So I went to the GP again. My GP must be sick to death of me. And I just said to her, I don't know what to do. I'm on crutches because I've got severe pain and immobility and I don't really know what to do. And she said, look, we'll just send you to a local orthopedic surgeon, just a local orthopedic surgeon. So that's who I saw in February this year. It's actually Valentine's Day, 14th of February. And I was all ready. I've got all my notes. I've got my notes about my PAO. I've got my pulmonary embolism notes. I've got all the information about having injections. And I was ready with my story. I thought, right, I'm going to go in there and explain everything about the hip dysplasia. And when you see a local orthopedic surgeon, they just take an X-ray and then you go in to have a chat. So I didn't really need to say anything to him. I didn't need to tell him a story. I just had the X-ray. I walked in the room and he said, "You're bone on bone, both hips. You need two new hips." And I was gobsmacked. I was absolutely gobsmacked. He said, "You've got advanced osteoarthritis." And now I've got the letter from the chap that I saw, the consultant that I saw who referred me for a PAO. The letter says minimal arthritis. So we're talking about under 3 years, 2.5 years, and I've gone to bone on bone needing crutches. So I must have looked flabbergasted. And he was absolutely lovely. It's Dr. Shyam Sander in Kettering. He was lovely to me, and he said, "You've got dysplastic hips." That's the first time I'd heard the word dysplastic as well. "You've got dysplastic hips. Osteoarthritis is rapidly going to come to you." And nobody had ever said that to me. And I said, "But I've had a periacetabular osteotomy to preserve my bones." And he said, "I can see it. It's brilliant. It's beautiful. It's put your socket in a lovely position for a hip replacement." But he didn't laugh, but he smiled and said, "But I don't know why they did that on you at 46, because you were always going to be in this position." And you can imagine that nearly cost me my life. That PAO surgery nearly cost me my life. And it feels like it was not unnecessary, but it was a bad decision. I made a bad decision because I didn't have all the information. Now, I have since Googled to find out, Dr. Google, about hip dysplasia and osteoarthritis. It's not difficult to find that information, that you will develop it earlier. And so, yeah, at the age of 49, on the 19th of March this year, I had my right hip replacement. That was 22 weeks ago, which is the one I'd had the PAO on. And then, yeah, tomorrow I'm going in for my left hip replacement. And then in October, I turn 50. So I've had 2 hip replacements in my 49th year. And that is my hip dysplasia story.
I'm a bit speechless. If I'm honest, I was just absolutely captivated listening to that story. You've been through so much physically and emotionally. I mean,
Yeah, I know. I take my
even
glasses
to hear
off.
all of that in that space of time, like
Mm,
the thing that hits me the hardest about what you said is that you were worried for your life. There were
mm,
moments when you said, "Am I going to die?" And then to
mm,
hear that there's a possibility that the surgery may not have been either the right decision or necessary.
mm,
That's that's a tough pill
mm,
to swallow, right?
mm. Yeah, which is why I wanted to talk to you, tell you my story, because I thought, if one person out there is listening to this story and they're umming and ahhing, they're in their 40s, I think I probably would really consider the fact and maybe ask a few consultants in their experience what they've seen, because I didn't do that. And I would have loved to have heard a story like this, and it maybe would have stopped me from going through that. And my consultant that's doing the hip replacements, he said to me, I've replaced hips in 35-year-olds because the dysplasia has brought the arthritis on so quickly. Which again, I never heard of that. You don't really know people that have got hip dysplasia. It's not talked about enough. I didn't know that. I didn't have a clue that that was the case. And my face when he said I needed 2 new hips, I must have looked horrified. And he sort of looked at me and said, "You've already done much worse." And that was the other thing, because I know I've heard you say that you potentially looking at hip replacement. And in all honesty, compared to a PAO, I would say a hip replacement is about 20%. It's not an easy surgery, and the first couple of weeks are the most challenging, but the recovery is so quick after that. That is so amazing. I went back to work 4 weeks after. I work in an office environment, but I went back to work 4 weeks after a hip replacement, and I went from the car to my desk without my crutches and obviously just up to the toilet and back. Whereas with the PA, I was 12 weeks off work. I went back to work on crutches and it was too soon. I knew I'd gone back to work too soon. It was really tough, lots of tough days and painful days. So yeah, I think a hip replacement, people really get frightened of that as a surgery, but it's absolutely amazing. It's amazing, amazing. It's impossible to have pain in a joint that isn't there. So my right hip, I don't feel any pain in that joint. It's a little bit overshadowed by the fact that the left one is so painful. And I keep saying to my husband, I haven't had the chance to celebrate this brand new hip because I'm struggling so much with the left one. So I've got that to come. I've got that sort of celebration to come. But yeah, a hip replacement is, it's nothing to be feared. They seem to do them so regularly. They know exactly what they're doing. And I was in compression socks for 5 weeks. And not only that, when you when you come round from the surgery, they have these things on your legs, those, I don't know what they're called, but they push air onto your calves regularly, like a blood pressure monitor on your arm, all through the night. And I can remember lay there thinking, wow, peace. I can just sleep now, knowing, because that was a big fear that I was going to have more blood clots. So I think they know what they're doing. They do it all the time. They do it on really old people. So when you're younger, yeah, I couldn't believe it. Sat up on the end of the bed and I thought, oh, this is going to be painful. And it really isn't. Stood up. I was like, wow. Got the crutches, took a few steps. I thought, wow. It feels like a PAO 5 months later. You're fast forward in your recovery. It was amazing.
It's quite an extreme difference, isn't it, in the experience
Mm,
you had between the two?
mm,
Um, do you think that there were things, because you'd had that experience of the PAO and the way that surgery went and the side effects that you'd had from the opioids afterwards, or the issues that you'd had with the PEs, do you think that that potentially helped guide you better for your replacement with communication with some of your other health professionals? Like, how did those experiences
mm.
guide you for your replacement?
I think for them, once they see pulmonary embolism on somebody's notes, they take that very seriously. So I felt like it's a bit dramatic to go through that just to get by. I got very well looked after. It was on the forefront of their minds regarding, straight in with an injection in the stomach, and then yeah, rivaroxaban, which is a blood thinner for 5 weeks. And myself, I knew I needed to get hydrated as soon as possible. I think hydration is key. But no, I was terrified. I was terrified going in for a hip replacement. I really was terrified. And I know you've had a previous guest talking about the fact that you're sedated, you don't have a general anaesthetic. That terrified me because obviously for a PAO, you still have a spinal while you're awake, but then you're under a general anaesthetic. So I was very worried about that without any need to be. Apparently, I shouted out quite a lot, but I've got no memory of that at all. Yeah, I don't know what I was saying, goodness. And you definitely don't feel it, because that was the other thing. I was thinking, well, if you shout out because you're sedated, what if you're feeling it and they don't know? But of course you don't, because the spinal block fully numbs you. And they do lots of really thorough checks to spray cold spray on your leg. If you can't feel cold, you can't feel pain. So you've got no worry at all. And the recovery is rapid from a sedation in comparison to a general anaesthetic. So it's another reason why you're up, walking up and down the corridor with your new, shiny new hip. Yeah, so yeah, hopefully I think if somebody was listening to this and they, yeah, like I say, they're in their 40s and they've potentially been told they were a good candidate for a PAO, my story might make them think, oh, is it worth it? Is it going to be worth it? Because there's a lot to go through. But if you're in your 30s or your 20s, your PAO can give you your own bones, but they actually said to me they were looking at 10 to 15 years, not two. The surgeon in Newcastle said that this will give you 10 to 15 years, but that wasn't good information because he hadn't factored in the rapid onset of arthritis in a hip dysplasia patient, which I feel a bit let down by. I would have loved that information. Possibly I would have still made the decision to risk it, maybe, I don't know, but I didn't have that choice to make.
It's such a difficult conversation to have because there are people that have had it all of every different outcome that you could possibly have at different ages and different surgeries. It's different for every individual, and I think that the really key point about what you've said, and I really want everybody to hear this, is that you needed to know exactly what was right for you and to
Mm,
have second opinions, third opinions, to get as much information as you possibly could have done to be able to have to make the best decision for you.
mm,
Um, and then perhaps, yeah, you would have, known a little bit more about the level of
mm,
arthritis you had, the level of development that was likely over the next few years,
mm,
and
mm,
understood more about what the risks were, and knowing more information can only give you a better handle on the decision that you're going to
mm.
make.
Yeah.
But obviously there are people at the other end of the spectrum who have had PAOs in their 40s and have had fantastic outcomes.
Mm,
Um, and so I think it's really important that the underlying message here is that everybody is an individual and needs to be treated as
yeah.
such, and that the
Mm,
more information that we can get, second opinions, third opinions,
mm,
to gather as much information as possible is
mm,
so important.
mm, mm. Yeah. Yeah. And I mean, I'm quite an optimistic person, so I try to look on the bright side. It didn't kill me. I did survive that. And you do live your life a little bit differently when you've come that close to losing it. And also, when I asked the hip surgeon who gave me a hip replacement in March if he'd cemented or screwed the cup into place, he said, no, it just slotted in because your osteotomy had given it such a perfect position. And I remember thinking, oh, that's one good thing then that came, because I did heal beautifully from the PAO. I didn't have any issues with healing. So it did give me a fantastic um, framework for the new hip to go in. Whereas tomorrow I'm having my left hip replaced, which hasn't had a PAO. That's a shallow socket. So I'm wondering if that's going to be more challenging for him. I think sometimes they do screw the cups in place or cement them. So that's the positive thing I could say. At least I had a great place for the cup to sit. But yeah, it was a lot to go through just for that. I probably could have tolerated a screw if I needed to. Yeah. I just pulled the crutches out just now because obviously I've just packed my hospital bag, and it just feels like the third time to use those crutches. It's just a lot to go through. And I cannot wait to draw a line under it and think, it's all behind me. It's now about strength. And I'm hoping to get some help from you. I didn't even know that you existed. It's all very new to me. But I really want to focus on some Pilates because I think your new hip is fantastic, but it's what you do to increase your mobility around strengthening it. And that will be where I will be when I've got two of them. So you can't just have a general Pilates teacher or general anything. You need somebody who understands what your anatomy is and what your body's been through. So I'm looking forward to that, and yeah, to get out trekking again.
Absolutely. Well, I very much look forward to working together with you on that. That was a lovely surprise to the conversation. But yeah, and it's great to know exactly what your goals are. Looking forward to. I mean, you're preaching to the converted here. I'm out in the mountains all the time. I absolutely
Oh,
love,
wow.
love all the walking. So yeah,
Yeah.
it's great that you've got something that you're looking forward to getting
Mm,
back to,
mm.
something that's going to really give you your focus to work
Yeah.
towards after having the second surgery. But I
Yeah.
just, it's such an emotional journey that you've been on, and like I said, it's so important to share that story. For I mean, there are so many things that you've said throughout this conversation that I'm like, okay, well, when I'm thinking about going through future surgeries, I'm going to want to think about, I'm going to ask them about this and this and this and this.
Mm,
Um,
mm.
so one of the things that you talked about from the first surgery that we haven't quite honed in on for the second one yet is, did you have different medication then for pain relief for your
Yeah.
placement?
Yeah, I did. They were absolutely wonderful. They did, obviously, when you have your spinal block, I think they put, I don't know if it's fentanyl or tramadol, but they do put an opioid in with that as a pain blocker. So I was really sick still. Um, but there are other ways they can give you pain medication. You can have suppositories. There's other things you can have that bypass the stomach, very, very well tolerated. So I felt, and I didn't need much, I don't know whether it's because the PAO, I had a lot of pain with that. I didn't need that much. I would say 2 weeks I was off. I kept a daily diary just so I could remember for this hip replacement. I think 2 weeks I didn't have any paracetamol or anything. Um, so you don't need as much, but they are just very aware. I mean, I've just had a meeting last week with the anaesthetist. It's the anaesthetist that deals with all the drugs. He's very aware of the opioid intolerance, and they take it really seriously because obviously they don't want you to be really in pain, but not being well enough to recover is also a problem. It must be really difficult for them. Um, but yeah, they've said they're going to start the anti-sickness even before I've gone under, because he said to me, treating a reaction to an opioid before it's given can sometimes be a really good idea. It's just knowledge, isn't it? Having that knowledge.
Yeah.
Mm,
And like I said, I hope there's so many things that people can take away from this conversation
mm,
and hearing your
yeah.
stories. So and it's
Mm,
absolutely without a doubt done that. So I'm
mm,
gonna go back and maybe make some of the key pointers of things that you've said that I think can be
mm,
an amazing addition to a checklist of conversations to have with
mm,
the person.
yeah, yeah.
So the topic of age with different surgeries is something that comes up a lot.
That's it.
And yeah, a lot within a lot of the different groups. It's quite a repetitive theme in conversations, in Facebook groups, in messages that I get, people asking advice about, I'm this age, is this a good idea? Should I do this surgery,
Mm,
do that surgery? Am I too old? Am I too young?
hmm
We get as many conversations about age around PAO being sort of later on, like late 30s, 40s, as we do about the amount of questions coming in for, I'm only in my 20s, should I have a hip replacement? So
mm,
it's
mm,
quite a
mm,
spectrum of concern about age with
yeah.
surgeries. What are your takeaways from the age
Well,
you are and the experiences that you've had? So I know we have covered some things, but I wondered if we can kind
mm,
of pinpoint a few things that you would take away from that with
I
age.
just feel as though, you know, if you're somebody who's in their 40s in good health, you've got a good BMI, and you haven't got signs of arthritis, then I would say a PAO is an option. But I just feel like it's very, very important for someone to at least tell you, so it's on your radar, that even though that's the picture, things can rapidly change. In other words, don't be surprised if in 2 years, like me, both your hips are going to be bone on bone. Don't be surprised about that, because it maybe would have made the pill a bit easier to swallow given what I went through. I still would have been making an informed choice, but I don't feel like I made an informed choice. I feel the information I got was, you're a great candidate because you have minimal arthritis. You could have 10 to 15 years of your own bones. So I snapped his hand off. I don't feel like that was completely right to say that. That I just feel like it's worth considering that some cases do have rapid onset arthritis. So bear that in mind. It still might be the right decision for you because, like you say, I also put it out on Facebook back in the day, 2018, 2019, when I was considering my PAO, and there were people there, 52, that had both sides, and there's back on site working a construction job, and I was thinking, yeah, I'm going to be that person, but you might not be. And it's just to have all the information just feels better when you're in my shoes than how it feels for me, which is a little bit like I made a bad decision because I didn't have all of the information. And that I'm disappointed about that.
So your takeaways for the story that I'm so grateful that you've shared is, and I don't want to summarize for you. Could you summarize maybe the sort of the top three takeaway points for us?
Well, get yourself some compression socks. and just literally have them in your bag. And no matter what anyone says to you, wear those compression socks. Take every single thing seriously that happens in any of your surgeries, because I nearly didn't ring 111. I can't believe that is the case, but it's true. And yeah, and just make sure you've got some second opinions and glean all the information. Like, you're putting so much information out there. There's other resources, and just make sure the decision's the right one for you, because it might be that a PAO is the right decision for you. It might be that you make that decision and then you end up in my shoes, but it was still a considered decision. Just get as much information as you can. And I think the more people are made aware of hip dysplasia, it's so hard, and it's so lonely, and it's so isolated. And even having my hip replacement, people said to me, "Haven't you already had that?" And you think, yeah, people don't even know what a periacetabular osteotomy is. They don't know what it is. People don't know what hip dysplasia is. They think dogs have it. And yeah, I think you should sit your best friend down. I've got a wonderful friend who, and my husband obviously, but my closest friend, who has just been amazing, because it's a long journey and you need that support, because it goes on and on and on. And you think, oh, it's my hips again. And you're sick of yourself. People must feel sick of you. But yeah, I think getting the right support, as well as information, the right sort of support. Sit your best friend down and say, "This could be a long one. Will you stand beside me on it? I'm going to need you," because you do really need that. And then the PAO group that I had, if you can find a couple of people that are in when you're in, or the week or after or before, we have helped each other on the darkest days when nobody understands. Oh, we haven't even met, and we feel so close to each other. I've texted them this morning. I'm like, this is it. I'm telling my story. And it's just amazing that you can have those strong connections because you've been through that journey together. So yeah, they're all my takeaways.
If someone else was looking for somebody to go through their situation with and have that similar support, I do know and have worked with a company called PAO Buddies. I haven't heard from them for a while, so I'll see whether they're still up and running. But how did you find your support people?
We literally found each other because one of the ladies called Rachel, I was meant to have my surgery with Rachel, who we were going in together. So we'd connected on Facebook. So we're like, oh, we're going to be together. And then they swapped Rachel out and they put somebody else in that was more urgent. So Rachel was the week after me. So she messaged me when she came up to Newcastle. I was like, "Do you need anything?" And obviously, I'm on day 8. I'm about to go. I was like, "Oh, bless you." And I knew what she was about to face. I was trying to say very little. Um, and so we were connected from that. And then the third person, Sophie, is her surgery buddy. So they were in together. So because we were always chatting, we ended up having this group. And yeah, we've all had different. So I'd love them to tell their stories. But all 3 of us have had stories to tell. And it just helps. You feel so much less alone. Because even the people that love you dearly, they don't know what you're going through. But those girls really, really did. And we used to do our exercises on a video, Zoom, and show each other how we were doing it. It was amazing. It was a lifesaver, honestly. We've talked about the most intimate of things that you don't really talk about, but we can, because we're all in the same boat. Yeah, it's been amazing.
That's beautiful. Thank you so much for sharing that. It makes everybody that's listening to this, I'm sure, think there is so much value. And you're right,
Mm,
it can feel very lonely when you're
mm,
around the people that you love the most, your friends,
mm,
your family,
mm,
and you just
mm,
still feel like nobody gets it.
yeah.
Even though those people that are closest to you love you more than
Mm,
itself,
mm,
you can still
mm,
feel lonely in their presence, and that's a really difficult thing to deal
mm,
with. Um,
yeah.
so to know that you've got the love and support from the people around you, your friends, your family, your loved ones, they can give you a certain element of support that can't be reached by other people. But then there is another level of support
Mm,
of knowing and understanding that
mm,
experience that you're going through
mm,
that just can't be understood by people that aren't going through that same experience. And
yeah.
it's beautiful to hear the
Mm,
experience that you've
mm,
had, and maybe
yeah.
maybe we can have a chat about doing a group podcast to see what you guys all went through as a group.
Oh God, that would be so good. Yeah, we've called ourselves PAO Warriors 2021, and every time I look at it, I think, wow, we're in 2024, but we're still there for each other. Because obviously, I've had a hip replacement. One of the other girls had gone on to have, she's younger, and then one of the other, she's had a baby with hip dysplasia. So there's been a journey for all of us. Yeah, it's a very precious sort of resource. I never want to lose touch with them actually because they were brilliant, absolutely brilliant.
Well, thank you, Joyce, so much for coming on and telling your story. I'll be super excited to put this one out and get this
Oh, that's
into the
great.
world. People coming on and sharing their stories like this is one of the best ways of raising awareness. People connect to
Mm,
your story, they
mm,
learn, they have so much information to take away from it, to then go away and do their own research, to take those questions to their consultants, and it's completely invaluable. So I
mm.
appreciate your time so much. Thank you.
Oh, I really enjoyed it. Thank you, Laura.